We know that while vet visits for your cat are important, they can be really stressful. So what we want to do is just guide you on how to make that a little less stressful. For cats, there's a lot of things that can stress them out, and we refer to them as stressors. So what a stressor is something that will upset the cat. And it could be various types of stimuli. There is something called stressor stacking. So your vet visit actually it starts at home. These stressors can build up and stack from home all the way up to the consultation room. So actually when we see your cat, we don't actually see a normal cat. It's a cat that has all these stresses built up from the time they left home. It can be various things such as if they are sick, that's already a discomfort to them. If they need to be fasted for something, that's definitely a stressor. Then they need to be picked up and put in the carrier. Transportation, that's definitely a stressor with the noise. And then they come here and sometimes they might have to wait. And the waiting area, they could hear some dogs, hear the phones ringing, various smells. That's an additional stressor. Then on top of that, we have to take them out and then examine them as well. So all of these build up, and it's what we refer to as stressor stacking. One important thing and a crucial thing that can reduce stress in these visits is picking the correct cat carrier. The ideal cat carrier is the plastic crate, the kennel, that can be opened up from the top. This is really important because even if the cat doesn't want to come out, we can take the top lid off and examine them in the carrier itself. How you make the carrier cat friendly is a week or two before you plan to bring your cat or your new kitten to the vet, you should make the carrier a part of the household. Because a lot of the times we put it away in storage and then it gets all these different smells into it. So what you want to do is make the carrier the cat's safe space. How you do that is you leave it open in the area where the cat or cats are. Make sure you put in a soft blanket that is theirs, so it has their familiar smells in it. You can use some treats and feed your cat in the carrier. Make sure he gets his meals in there, so it's something he's really comfortable with and doesn't get afraid to go inside. And then sometimes he might even sleep there. So those are little tips and tricks you can do to make it his or her safe space. Once you've done that, what we want to focus on is how you put him or her in the carrier. Again, with cats, we have to be very slow, very gentle. You have to take your time with cats. So make sure it's a gentle process. You don't want to shove them in there, because they might later be super mad at you. And then a really important step, which we most often might miss, is to carry an additional towel. So with this second towel, you cover the carrier from the outside. So this will reduce visual stimuli a lot and a dark, safe space, so he or she will feel comfortable enough. Make sure it's not a super thick blanket, especially in our climate, and also make sure there is enough ventilation on one of the sides as well. So that's why the ideal cat carrier is great, because it has a little front door and you just have to cover the top and the sides. And when you do hold the cat carrier, make sure you do give it some support from the bottom as well, because we don't want it to shake, because cats don't really like to be out of balance either. Then we come to the traveling part. What you want to do is, if you have your cat carrier, place it at the back behind one of the seats so it's very secure, so it doesn't move much, and use the towel again on top. Make sure it's not super noisy in the car as well. Make it as smooth as possible for your cat, and then you can bring your pet to the clinic. Once you are at the clinic, keep the towel on the carrier as well. We usually want to minimize your waiting time, so make sure you are on time for your appointments, or you can call ahead of time to see if they are going on time. We advise not to keep the cat carrier on the floor, because cats like elevated spaces. So make sure if you are waiting, keep it on top of a chair, or if there's room available, keep it on top of the table until your vet comes in. Last resort for uncooperative cats who probably had a traumatic experience before that we don't know about, and maybe that's why he hates coming to the vet. There's always medication, and your vet will advise you on this. One of the medications we do use is gabapentin. It's the most commonly used and safest medication, so it really helps in reducing stress and anxiety of your cat. And we can adjust the dosage as we go along. We've tried it so much. It's worked brilliantly. We do really advise, if your cat is uncooperative and really stressful, coming to the vet and at the consultation as well. So this really will help the experience your cat for you and the veterinary staff involved as well, and just make everything a whole lot smoother. Lastly, about what to do once you come home from the vet. Again, some cats will probably be super stressed out anyway, but what we want to do is make it a smoother transition once they come home as well. So sometimes they could come home after surgery, they're probably still on the effects of anesthesia and things like that. So we want to keep them in a quiet area, maybe away from the other pets. If you do have other pets at home, keep them calm. Don't go to play with them or anything too much. Just give them the time, the space, because cats are very special and they're very different. Then every visit after that will be a whole lot smoother for you.